Hi, I'm Dr. Robert Carlson. I wanted to explain a little bit about estrogen, hormone replacement therapy, and breast cancer. And the reason why that occurs, and just to kind of clear up all this confusion. My background is I was trained as a general surgeon and a cardiac surgeon, but during my general surgery training, I worked with some of the best at the University of Florida. The physicians, the surgeons that wrote the book, all trained at MD Anderson. A number of the residents I worked with have all now be in department heads throughout the country. So I have a lot of experience in working with individuals with breast cancer. So one of the things I was told during my training is that estrogen causes breast cancer. And so I just assumed that was it. So here's the problem. If estrogen or estradiol really causes breast cancer, and 80% of breast cancers occur post-menopausal, and at that point in time in a woman's life, her estradiol levels are lowest than they've been almost their entire life, in some cases lower than when they were 9 years of age. So why does estradiol cause breast cancer? And the answer is it doesn't. It doesn't. Because if it did, women who are in their 20s, 30s, or when a woman was pregnant and her levels are 800, 900, she would have breast cancer at that time. It would be rampant. Why does breast cancer occur when a woman's estradiol is 8 and 9? When most of her life it was in the 2, 3, 400 range. I think there's a lot of confusion about breast cancer and why it occurs. And a lot of concern. Women actually are concerned because the Women's Health Initiative showed that 29% increase incidence of breast cancer in women. The issue is they were given synthetic progestins, synthetic estrogens. That's the problem. Whereas a wonderful study of 24,000 women in Switzerland who were using, 70% of them were using bioidentical hormones, there was actually a reduction of 26% in cancer. So why is that? So the major reason why breast cancer occurs is because of the production of estrone and its conversion using this enzyme 3A4 to 16-hydroxyestrone. 16-hydroxyestrone is a carcinogen. It's associated with breast cancer, uterine cancer, ovarian cancer, and in men, prostate cancer. So we need to find ways to reduce 16-hydroxyestrone. And by the way, that's called prevention, not early detection. Prevention is how can you reduce that enzyme from forming that carcinogen in the breast tissue? And the answer is actually pretty simple. The answer is eat a lot of cruciferous vegetables, broccoli, cauliflower, Brussels sprouts. Number 2, don't smoke. Number 3 is exercise. And number 4 is not to be overweight. So mom was right. Eat your vegetables, exercise, don't smoke, don't be overweight, and also do your homework, but that has no impact on 16-hydroxyestrone, the carcinogen that causes breast cancer. So prevention is most important, and you control that. Nobody's making a lot of money on you eating right, you not smoking, you exercising, but it's giving you health. It's giving you a reduction in breast cancer. So take the step forward, get control of this issue, and you will be healthier than you've ever been.